Hello, I'm Carol Hartz, President of the League of Women Voters of Sarasota County. I want to introduce Ruth Brandwine, Chair of our Healthcare Committee. Ruth, who is Professor and Dean Emeritus at Stony Brook University, has been an advocate for improving health and human services in Florida and Sarasota for the last 10 years. She helped in Senate passage of Medicaid expansion in 2015.
What is Medicaid expansion and why does it matter?
Good morning, everyone. Medicaid expansion is part of the Affordable Care Act, but the Supreme Court ruled that it must be left to each state to opt for its inclusion. Medicaid expansion would cover adults aged 65 up to age 65. Mostly these are mostly working people whose income is up to 138% of the federal poverty level, which is about $17,000 for one person and almost $30,000 for a family of three. And the government is guaranteed to pay 90% of all costs. That's by law. Now, under current Medicaid, parents with dependent children qualify only if their incomes are less than 30% of the federal poverty level, about $6,600. So this would be a marked improvement for both families.
Okay, sounds good. But with the current state budget problems and with so many more people enrolling in Medicaid now, how can we afford to open it to so many more people?
Well, the difference is that Medicaid, as it is now, the federal government pays 61% of the cost and the state government pays 39%. With Medicaid expansion, the federal government would pay 90%, the state would only pay 10%. Actually, it will help the state budget because with Medicaid expansion, the state will bring in almost $200 million more in 2022-23 than it does now. And that's net, that's after all the costs for the new Medicaid people on it. Even after the state's 10% for new recipients, there would be savings because many people who are now on traditional Medicaid, like pregnant women, disabled people with AIDS, the medically needy, and so on, would be eligible for the 90% federal enhanced match instead of the current match. 38% of the states and DC have now adopted Medicaid expansion, as you can see on this slide. Okay, now you can get rid of the slide. And all have saved money. None of them that have started Medicaid expansion have quit, have opted out. In 2019, Michigan, for example, saved $141 million, Arkansas saved $137 million, and Louisiana saved $363 million. There's also the multiplier effect. That's a 1.5 to 1.7 increase. That means that because of additional salaries, Medicaid, medical equipment, its fees, and other things, for every dollar spent on Medicaid, it would add between $1.50 to $1.70 into the economy through that additional spending.
Well, what difference will it make for Sarasota?
Well, I'm glad you asked that. As you can see from this slide, the 10,790 people in Sarasota were uninsured for Medicaid expansion before the pandemic. We don't have the new figures, but it's certainly well over 11,000 people now in Sarasota alone. Now remember, almost 10,000 more people were unemployed in 2020 than in 2019. Many lost their health insurance, and more than 19% of the unemployed have no health insurance. If more people are covered, they will not have to use the emergency rooms. Right now, 36% of people in Sarasota use emergency room or urgent care when they need health care. Instead, they'll have regular doctor visits and screening for chronic health issues like diabetes and high blood pressure. Prevention and treatment can bring earlier savings cost. And treatment can begin earlier. That will be saving costs of high hospital bills in the later stages of disease. Moreover, since COVID, there's been a tremendous increase in depression, suicide, alcohol, and drug abuse. Medicaid expansion would cover 90% of treatment costs for eligible adults. Right now, The county and state pay for medical care, including mental health and substance abuse services in jails and prisons. 90% of that would be covered by Medicaid expansion. It's a no-brainer. Sarasota County Department of Health and Human Services contracts with local agencies to provide some mental health, drug abuse, alcohol, and other services. Instead of the 100% that the county now pays for these services, the cost would be reduced to only 10% for many recipients who would be eligible for Medicaid expansion.
So it may save the government money, but what will it do for me and for other people in Sarasota?
Well, the biggest reason for personal bankruptcy is medical and hospital bills. People shouldn't have to choose between paying their mortgage or putting food on the table and paying their medical bills. Testing and treatment for COVID-19 would be covered. Now, only if you have private insurance or Medicaid coverage or Medicare do you not have to pay out of pocket. Early screening would be covered, so more preventive and early treatment for cancer, diabetes, high blood pressure, and other chronic illnesses would be covered. Healthcare coverage reduces the premature death of those people 55 to 64 years old by about 40 to 60%. It will also reduce racial disparities that we now have, both in our county and nationwide, in maternal and infant deaths, cancer, heart, and kidney disease. With health coverage, you can look for, keep, or change your job without worrying that you would lose your health coverage.
Okay, you've convinced me. Now what can I do?
Well, first you can join Voices for Health. That's a statewide coalition of over 100 civic, health, faith, and labor organizations around the state. If you've had a problem accessing healthcare because of lack of health insurance, you can tell your story at www.healthcareforfl.org. That's www.healthcareforfl.org. Also, tell your friends and families to support Medicaid expansion. The League of Women Voters has speakers. Invite us to speak to your club, church, synagogue, or mosque, in your condo or homeowners association meetings, or other groups to learn more about Medicaid expansion. You can write a letter to the editor in favor of Medicaid expansion. In the coming state legislature, we have Senate Bills 556 and House Bill 341 that have just been introduced. Please contact your local state senator, which is Bruder's here in Sarasota, to co-sponsor Senate Bill 556, or your House member and ask them to co-sponsor one of the Medicaid expansion bills. This will be on the screen, how to use. As you can see, here are the phone numbers and emails for our state senator and our local legislators. If you live outside of Sarasota, you can go to the state house and Senate sites to find out who your representatives are. Now, we also have a fallback position. We hope these bills will pass and that the governor will sign them. But just in case that doesn't happen, we will start a petition campaign to allow voters themselves to vote for it on the 2022 ballot. Several states have approved Medicaid expansion through this process, both red and blue states. So make sure to sign the petition if it's asked. I'd like to invite everyone to a League of Women Voters Hot Topics on Tuesday, February 16th at 7 p.m. Anyone can register. You do not have to be a League of Women Voters member. All you need to do is go to this website, lwvsrq.org, and then scroll down to where it says League Events, and then you'll find it, and then just register. So I hope you will join me. Again, go to lwvsrq.org to register for the February 16th Hot Topics on Medicaid expansion. Thank you for joining us on this YouTube today. I hope that you gotten more understanding of Medicaid expansion, and please take action. Thank you.